Well, good afternoon, everyone. My name is Ryan Grahar, and I am Legislative Director of your New York State Association of Counties. On behalf of President Jack Marin and Executive Director Stephen Aquario, I want to thank you for joining us this afternoon for a virtual fall seminar workshop as we explore lessons learned from COVID-19 and emergency management. Our 2020 virtual fall seminar is taking place from September 15th through the end of September and includes nearly 20 workshops and meetings designed to bring the latest information on issues facing today's county leaders. We thank you for joining us as we hashtag counties forward together, and we encourage you to tweet about what you're hearing throughout the conference. At this time, I'd also like to thank NYCEM for sponsoring this session. NYCEM is a nonprofit technology consulting company advising agencies, organizations, institutions, and businesses since 1996. They help clients plan and manage the acquisition, implementation, and security of their IT systems. They are a trusted partner to government at the county, state, city, and local level, helping our clients achieve real business outcomes. Before we begin this webinar and before I begin our speakers and panelists who joined us this afternoon, I would like to share a brief 3-minute video to help you get to know a little bit more about NYCEM.
Hi, I'm Mike Walsh, President and CEO of NYCEM. It's been a privilege to partner with emergency management subject matter experts on numerous public safety initiatives, from design to development to implementation, both before COVID-19 and now, while we still face the reality of a pandemic. One of those experts is Joe Pfeiffer. He was the Chief of Counterterrorism and Emergency Preparedness for the New York City Fire Department. Over his career, he commanded some of the largest disasters in New York's history. Today, he teaches about crisis leadership at Harvard and Columbia University.
Hi, I'm Joe Pfeiffer. The last time I spoke at NYCEM, our world was very different. Now we are combating COVID-19, challenging our understanding of emergency management for very large-scale events. Never before have so many people been at risk. The question for us is, how do we prepare for the next wave of the pandemic? From my experience, there is a 3-step process we must undertake. First, reflect on the past. What worked? What didn't work in limiting the spread of the virus and managing the medical response? Second, envision the future. What do we want to see in place to help the state, our communities, and hospitals better deal with the multiple aspects of COVID-19? And lastly, work together. How can we leverage each other's resources to handle the next wave of the coronavirus? In the midst of this pandemic, each of us needs to sustain hope by unifying efforts to manage this event in the face of great tragedy.
Since March 2020, county executives, managers, legislators, along with commissioners, emergency managers across New York, have acquired a wealth of experience related to public health and emergency operation frameworks. This fall, NYCEM will be forming a working group consisting of current executives, emergency managers from many of the counties to advise in numerous areas such as common information and communication requirements, technology and network requirements, space, staffing, and financial requirements, lessons learned during COVID-19 operations, interdependencies, and the ability to share information and the workload. In the next few weeks, we'll be reaching out to counties to set up a time to talk. We're looking to tap into your vast knowledge network to identify pain points, workaround solutions, and best practices. We're counting on you to help everyone benefit from your experience. Our sincere thanks to the New York State Association of Counties, county executives, managers, and legislators. Together, we will help improve future operational frameworks and performance across New York State.
Okay, thank you, NYCEM. So counties are busy preparing for a potential second wave of new COVID-19 infections. And as we brace ourselves for that next wave, what can we learn from our recent experiences? This workshop will address some best practices and innovative approaches for communicating with the public, keeping the infection rate low, reducing hospitalizations, and keeping our ICU beds free and clear of COVID-19. Counties have a role in managing public expectations as we enter the flu season. We are joined today by leaders from Dutchess, Westchester, and New York City. I'm very pleased to have all of our partners with us this afternoon. Today we're joined by Dana Smith, Dutchess County Commissioner of Emergency Management, Joan McDonald, the Westchester County Director of Operations, Ira Tannenbaum, the Director of Public-Private Initiatives in the New York City Office of Emergency Management, Dr. Eric Way, Senior Vice President of Quality Utilization and Risk Management for New York City Health and Hospitals, and Peter Hatch, the COVID-19 Public-Private Partnership Czar, along with other representatives from the City of New York. In January 2018, Westchester County Executive George Latimer appointed Joan McDonald, Director of Operations for Westchester County. As the Director of Operations, Joan is responsible for setting all public policies for the county, has the direct supervision of over 12 departments and 4,500 employees. Joan has direct responsibility for overseeing the $2 billion county budget. On August 26, 2015, Ms. McDonald was appointed to the National Infrastructure Advisory Council, NIAC, by President Obama. Joan has been on the NIAC working group to evaluate the country's cyber vulnerabilities, clean water, and the impacts of a long-term power outage. In September 2016, Joan was appointed to the TRB Policy Commission to evaluate the future of the interstate highway system. The evaluation of a 2015 congressional mandate has resulted in a report and recommendations that went to Congress in December 2018. Joan has also served as the commissioner in 2 states, Connecticut and New York, and as the 11th commissioner of the New York State Department of Transportation, where she was in charge of the department through various weather events, including Hurricane Irene, Superstorm Sandy, and many snowstorms. And she instituted the Forward 4, which was a national model for capital planning and project management. Joan has served in senior management positions for the City of New York, Metro North Railroad, and Jacobs Engineering, and she began her career at the New York State Assembly. Peter Hatch. In March 2020, Mayor de Blasio appointed Peter Hatch to the city's COVID-19 Public-Private Partnership Czar, which is part of the mayor's senior leadership team combating the pandemic. In this role, Peter has led successful efforts to raise nearly $100 million in cash and in-kind contributions to fund new programs to distribute PPE, feed essential workers, and provide emergency financial assistance to the most vulnerable New Yorkers impacted by the COVID-19 crisis. Mr. Hatch most recently had served as the Chief of Staff to the Deputy Mayor for Health and Human Services and Senior Advisor to the Mayor on street homelessness. As Senior Advisor, he led the Mayor's multi-agency task force responsible for the development and implementation of the Journey Home, the city's action plan to end long-term street homelessness. Ira Tannenbaum is the Assistant Commissioner for External Affairs at the New York City Office of Emergency Management. Serving as the primary liaison between the city and businesses and private sector organizations, Ira coordinates the integration of private sector concerns, interest, and resources to support New York City's emergency planning, preparedness, response, and recovery activities. Ira harmonizes the exchange of information between the city and the private sector and works to include the private sector in the city's emergency plans by overseeing the private sector COOP emergency support function, which incorporates private sector capabilities into NYCEM operations. He is also responsible for NYCEM's Partners in Preparedness program, which helps organizations better prepare their employees, services, and facilities for disasters, CorpNet, an emergency information sharing program, and NYCEM's Business Preparedness Education Initiative. In 2013, Ira was recognized as a White House Champion of Change and Community Resilience and Preparedness for his innovative work to increase private sector participation in emergency preparedness, response, and recovery efforts. And our last speaker, Dr. Eric Way, is the Senior Vice President and Chief Quality Officer for New York City Health and Hospitals, the largest municipal health system in the United States, with 11 acute care hospitals, 5 skilled nursing facilities, 60 plus community health centers, a home care agency, correctional health services, an insurance plan, Metro Plus Health. He leads the Office of Quality and Safety, focused on fostering a culture of safety, building tiered quality improvement capacity across all 42,000 plus staff, aligning improvement efforts with the system vision and strategic pillars, and becoming a data-informed, high-reliability organization. Dr. Way also leads care experience, high-value care, arts and medicine, spiritual care, data governance and analytics, emergency management, hospital police and security, and Helping Healers Heal, H3 program. He is the fellowship director for the New York City H&H Clinical Leadership Fellowship, and he is practicing emergency medicine physician rotating through all 11 emergency departments in New York City H&H. He also serves on the board of Metro Plus Health and on the advisory committee for the Greater New York Hospital Association United Hospital Fund Clinical Quality Fellowship Program. Previously, Dr. Way was the Interim Chief Quality Officer and Associate Medical Director for Quality, Safety, and Risk for LAC and USC Medical Center in the Los Angeles County Department of Health Services, the second largest public safety net system in the United States. In LA, Dr. Way led lean teams in the emergency department, built the H3 program, created quality improvement capacity programs, and led team steps in just culture implementation. He has a bachelor's degree in molecular, cell, and developmental biology from UCLA. He completed the combined MD and MBA program from the University of California, Irvine in 2009, and he completed his emergency medicine residency and the Healthcare Administration Scholars Program at the University of Michigan in 2013. I want to take a moment right now and thank all of you for joining us to share your expertise and experience with county membership who joined us for this webinar. And as a bit of housekeeping before we begin, I will note that if any of the participants this morning have any questions, please feel free to type them into the question panel on the right-hand side of your screen. We will answer those questions in the order which they are received after this afternoon's planned remarks. And again, thank you for being with us today. I hope that you will find this presentation helpful and educational. And I will now turn the presentation over to Dana Smith to discuss his role in Dutchess counties and the response efforts in the lower Hudson Valley. Dana?
Good afternoon. Thank you, Ryan. First, I want to thank the association and NYCEM for sponsoring this event today and bringing us all together. And the other panelists I'd like to thank as well. They're all very busy, and for those who are attending, I know you're given the panelists today and your experiences, I think we can all come away from something with this, and that's a very positive thing. I think for those of us that have been involved in pandemic planning for any period of time, I think we can all agree this event didn't really go the way we thought it would, or as the book said, and it was forced us to improvise and adapt, and I think that's one of the key things that we're all good at, and it was paramount with this event. Here at the Department of Emergency Response in Dutchess County, our emergency management wing basically set up a logistics section, and that was our role to support public health and all the entities in the county. Our key to success with that, I think, was communication. County Executive Molinaro, those of you who know him, is a pretty aggressive leader, and he made sure we communicated with all the different groups. We established work groups to work with all the different disciplines and community different facilities to make sure we could understand exactly what their needs were. Though PPE yet today, in the end of September still is a challenge. Our staff were able to work aggressively, partner with other agencies, other counties, the state association. Although our PPE distribution was rationed, I would call it. We were able to meet the needs of the community. All their desires may not have been met, but over time, we made sure they were protected. And I think that was key. By aggressively working with all these different groups and facilities throughout our community, we were able to supply them with the necessary PPE and minimize the spread of disease in the community. And I think that was paramount. Through a variety of means of communication using technology, teletown halls, the different web-based platforms of communicating with all our partners, I think that was key. And working through the association, I don't want to sound like a commercial for them, but the number of visits and meets myself and the executive director had alongside the Thruway, I think was very important, and it benefited many counties throughout the state. And partnering with some of the very counties that are on this panel right now, late night phone calls to help resolve challenges with the supply chain was key for us. Going forward, we want to be in a better position to be prepared. We know that we're in some ways we're on our own, and we tell our residents of our community to be prepared. We have to be in the same position, and our staff are currently doing that and working with other partners across the state, and that needs to continue. And I think that's key, is the county-to-county assistance that occurred during this event definitely had a positive impact on the response to the virus, and I think that will continue going forward. That's my opening remarks, Ryan.
Excellent. Thank you, Dana. And Commissioner Smith is going to facilitate a roundtable discussion with our speakers, and we'll get to the questions if any of our attendees have them at the conclusion of everyone else's remarks. So thank you, Commissioner Smith. And with that, I would like to now turn the presentation over to Joan McDonald.
Okay, good afternoon, everybody, and thank you, Ryan, for pulling this panel together. I think one of the lessons learned is how important it is, as Dana said, to share information and to share experiences and how we can continuously improve. I'm going to spend my time on the macro issues. As the Director of Operations, all of the county departments report up to me, as Ryan said. We all remember when the state shut down, but I think from Westchester's perspective, our dealing with the coronavirus actually started on February 10th, when one of our Westchester County residents was returning from a funeral in China, came through JFK, and we had to immediately quarantine her. She took they did the test, and if you remember, again, 10 months ago, early February, all of the tests for all of the swabs for testing went to the CDC. So because of the small number of cases we had at the time, but we still had to quarantine this person, and we never knew that we were going to use one of the cabins in our county parks as a facility to quarantine a person. This woman could not quarantine in her house because there wasn't the physical capability of doing that. So fortunately, some of our cabins in our county parks have heat, hot water, and internet access and are furnished. In fact, a couple of couples who had put bids in to use rent the cabins for Valentine's Day weekend were sadly turned away. So that's when our work on and our emergency response actually began. But I think just like everybody else throughout the state of New York, it really began in March in earnest. And I think all of us that are involved in emergency response deal traditionally with weather issues. And weather issues are traditionally the weather event is 2 to 3 days, whether it's a snowstorm, a hurricane, a tropical storm, and then it takes a week to recover. You know, Sandy, Irene, and Lee took a little longer, but there's a defined end date where you can restore the power, repair the roads, restore the bridges. One of the unique components of this situation, emergency response that we're in, is there was no end date in sight. There still is no end date in sight. So that is, I think, when we talk about the human infrastructure and how to make sure that the human infrastructure is prepared and is taken care of in all of our emergency response departments. That's something that we really have to focus on going forward. And again, and the second point along that line is that traditionally, as Dana was saying, emergency response is not restricted, but it's pretty much a couple of traditional departments: emergency services, public works or DOT, sanitation. So it's a small number of government departments that respond to a weather event. This was different. It involved everybody, you know, whether it was how to deal with your correctional facilities and make sure both the residents and the staff were safe, how to deal with how your social services responds to child protective services. So they were all issues we had to deal with. And I think some of the things that as a county government, we never had the lead role in, we were now finding ourselves in a position to be the leaders. When the governor issued his executive order, putting in place that, you know, the state would basically, state actions would supersede all local government actions, our county executive immediately put in place 3 days a week conference calls with all of our 43 municipalities to go through all of the issues together. We didn't have all the answers, but we took down a lot of questions. He did a daily update on what was going on in our county, the number of active cases, the number of positive cases, the number of tests, how many beds we had, et cetera. So we started doing that early on, and we made a critical decision. Our county attorney opined that we could share information in a confidential share file of who the positive residents were, which we would share with that particular municipality and the emergency responders, the EMS, firefighters, and police, so that they would know before they went to a house. They wouldn't know the name, they would not know the identity, but they would know at 1 Main Street, there was a person that had tested positive, to make sure that they had the appropriate PPE, because at the time PPE was scarce and we wanted to make sure they were protected. We were in the business of developing food distribution plans, working with our health department, social services, and our not-for-profit organization, and making sure you know, food was being distributed to people that were in need. We worked with our school districts on developing childcare plans, and in fact, we put in place a couple of programs with our not-for-profit providers that we opened up to essential employees. We served a number of essential employees. We provided childcare to a number of essential employees from the city of New York who reside in Westchester. So we opened it up to anybody as long as they, you know, had proof that they were an essential employee. The one thing that our emergency services department had never had to do before was develop a fatality management plan, which was right the weeks leading up to Easter Passover is when we saw our highest number of deaths. And we were getting calls from funeral homes and the hospitals that they were running out of capacity at their morgue. So for anybody that's in emergency management, you know, if you have a good team, they developed a protocol, and it was bringing together our chief medical examiner and our health commissioner, as well as emergency response, to develop the plan, which we did, and it worked out pretty successfully. As we all know, at the same time as we were dealing with the health aspects of the pandemic, we also went into the worst economic downturn since the Great Recession. And the question of when businesses were going to open, how they were going to open, I think we're still answering questions. The latest one we did was the reopening of gyms and spas. So the county executive created a reopening task force with 2 members of each sector. They just voted today at their meeting that they want to continue, even though they felt that a lot of their work was winding down. They wanted to continue to make sure they were prepared for the next round. We set up, I think as many of you did, using our county IDA, a $500,000 grant and loan program, and we were fortunate we got some CARES Act money directly, and we established a $10 million grant and loan program for businesses up to 100 people. How did we deal as a county when everybody was working remotely? Our IT departments stepped up to the plate, made sure that everybody had phones, laptops, etc., that they could plug in. And then when it came time to reopen, we developed a template for each. We developed a template, but we required each county department to develop their own plan because each county department is unique. We're in the business of installing plexiglass, providing PPE, and coming up with ways to make the workplace safe. I think some of the lessons that we have learned overall, as I said right at the beginning, is how to make sure the county workforce or the city workforce feels safe. It's working very closely with our public employee unions, letting them know when we don't know the answers, working with our business organizations, and taking everything that we have learned and that we were developing as we went along, and now memorializing them into policies and procedures. And I think most importantly is relying on the decision-making, judgment, and professionalism of the staff of government, and seeing how they all stepped up to the plate and went the extra mile, and relying on that professionalism is very important. So I'm happy to answer any questions and look forward to the conversation.
Joan, thank you very much for sharing your perspective of Westchester County. Certainly had to be, I can't even imagine being there when the first case came to your doorstep and you had to identify a cabin to help isolate that individual. That's pretty moving message. At this time, I would like to now turn it over to the New York City Office of Emergency Management, IRA, and then at the conclusion of this presentation, we'll hear from New York City Health and Hospitals, and Peter Hatch, the COVID-19 Public-Private Partnerships Czar. And then, like I said earlier, we'll have Dana Smith from Dutchess moderate a little roundtable discussion with our speakers, and we'll also go through some questions that are submitted on the webinar feature. And I'll remind attendees before we turn it over to New York City that if you have any questions throughout the presentation, please just type them into your question box and we will get to those at the end. So with that, Ira, I'll turn it over to you.
Thank you very much. Thank you for inviting us to participate. And I certainly want to also share appreciation with Ariana Kaplan, our colleague from Intergovernmental Partnerships, who was instrumental in pulling our group together on the New York City side. And I'm going to go a little quickly because I know that my colleagues from New York have a good deal of information to share. And then always the best part of these conversations is the Q&A. So I wanted to just touch on a couple of things on the next slide. We have a couple of slides. The concept has been the theme that you've heard so far repeatedly is that everyone has a role in this kind of emergency. It's a citywide event. It's a national event, and so one of the things that was particularly important to us from the beginning is to make sure that we had the right people around the table. It was important to the mayor to make sure that every city agency knew that they had a responsibility and that they were at the table their experiences. It was not just the Department of Health, not just a public health issue. It was going to have an impact, and we want to make sure that everyone is around the table. And I think some of the things that I wanted to just mention today are things that, while at a New York City magnitude, we have a lot going on, but these are some of the simple topics or concepts that can be applied regardless of the size of your organization, regardless of the size of your municipality. But these are some critical concepts. One of the things we did take advantage of pretty quickly, a lesson that we had learned from Sandy, was that we have to know how to get big enough fast enough, and we have to know how to, even with our significant resources as a city and a city workforce, we still needed to be able to bring in employees to surge the emergency staffing in the emergency operations center and at the various task forces that we had set up throughout the course of the initial response and even continuing until now. So there is an opportunity, especially now or before you need it, to think through these contracts, get them in place, understand how you're gonna be able to turn them on, what you're gonna need to do, and not have to worry about that or focus on that when you need them. That we were able to rapidly bring people in, both for the EOC and then ultimately for other components and resources, including ultimately the military. If you go to the next slide. And then, of course, information sharing and data were critical elements that everyone has heard over and over again. Transparency is key, but transparency is important as long as you are all sharing the right data and the same data. And so that was one of the critical elements that we built out in the Emergency Operations Center. By bringing all the resources, by bringing all the agencies together, we were able to make sure that the information flowed through in a way that was understood and a way that was able to be presented to the mayor, to the leadership, to the different agencies, so that they can take action. And even more importantly, we took that data and we made it available to the public. We made it available to our private sector partners so they can make decisions, so that they can understand what we were looking at when we were making decisions, and ultimately the general public, through our messaging, was able to understand why we felt this was so important and what the actions were that we were asking them to take during this event. One of the other unique elements that I think is critical to the role that we played is to make sure that we're also looking, while the COVID response is critical, how are we applying these COVID lessons to the other plans? How are we going to safely shelter people during a coastal storm if we have to now have social distancing? How are we going to make sure the right resources are in all of these response plans? And so we took a group of people from multiple agencies together to work and focus on just that particular issue, and think through the impacts to all the other plans, not just the one emergency that we were faced with right now. So with that, I will turn it over to, I believe Dr. Wei is up next, to talk more detail about the health and hospital and the emergency response from their perspective.
Thank you so much, Ira. Can we go to the next slide, please? And so similarly, I'd like to first thank NYCEM and NYSTEC for hosting, I think my esteemed co-panelists and Ariana Kaplan for keeping us organized on the New York City side. And so I'm going to give the perspective from the hospital response, New York City Health and Hospitals, the largest municipal healthcare system, and we are in these neighborhoods that were disproportionately struck by COVID-19. And so very early on in December and January, we were following along in what was happening in China. Our emergency management special pathogens team were tracking. But it all seemed sort of theoretical, and I still remember back to early March, we were still talking about having tabletop exercises. You know, theoretically, if 75 ILI type patients showed up in our emergency department at the same time, and our CMO actually threw in plus 6 feet of snow outside, you know, what will we do to be able to handle that? And I still remember March 7th, you know, it was a Saturday. We had a newborn 3-week-old at home. We were taking our 3- and 5-year-old daughters for our normal routine ballet class, then pizza, then swim class, right? But we were also having a discussion about what was going to happen on Monday. Monday was my next emergency department shift. And now knowing that we had a positive case in our system, as well as, you know, what's going on in Westchester and then spreading in New York City, and having a 3-week at home, made a heartbreaking decision to isolate from the family, right? And so it felt like it went from a theoretical to a tsunami tidal wave in terms of what we experienced over the next couple of weeks. And so first things first, we had to make room for this influx of COVID patients. So setting up Roosevelt Island Medical Center to camp 350 patients out of our hospitals that were non-COVID to make room, as the governor asked us to, you know, triple critical care surge space. I think something very early on, it was right, just the fear, the same fear that I had for my newborn son. Everyone in New York City was going through that. And so immediately standing up an emotional psychological support steering committee, bringing together both our Helping Healers Heal as well as our behavioral health services together to support our staff, and quickly, you know, realizing that people had additional burdens on top of, you know, coming and running towards the fire to treat COVID patients. It's harder to get food. It's harder to get a ride home. And so quickly started sending meals to our facilities and turning to philanthropy to continue to support whatever we could in terms of comforts. I think one of the early decisions that we made that made a big difference is, right, our staff is our most precious resource, as they are in all of your healthcare facilities. And CDC, right, the WHO in terms of PPE guidelines, at one point, we just pulled the trigger and said, right, we're getting surprised way too many times in the emergency department, asking questions about travel to Wuhan, asking questions about travel to Westchester. It wasn't matching what we were seeing. People were getting hit by cars and coming in, and you do a COVID test and it's positive, right? Or you get a CT scan and their lungs are COVID lungs. So we just started having to protect our staff, treat every patient in the emergency department, treat every patient in the ICU while we were still lacking the testing that we needed, as potentially COVID patients. And let's have N95s on, let's have face shields on, and protect our staff. I think communication with patients, with the public, we were manning the 311 calls that were coming into New York City. I did a couple of those shifts. And you're talking to one person, hearing their heartbreaking story about how they can't go back to work until they get a COVID test, but somehow they don't match the DOH guidelines at the time. You're missing like 15 additional calls that our dispatchers are trying to send to us. I spoke to one young man he was in his 4th emergency department in the same day when I finally, you know, was able to call him back, because the first 3 wouldn't test him. He was hoping the 4th one would test him. And then thinking about, right, what happens to those with chronic disease, your diabetics, your hypertensive patients, how to continue to provide essential care in a pandemic was something that early on we had to figure out, and telemedicine was a huge part of that answer. Next slide, please. So thinking back to the peak, like Dr. Katz, I was in LA before coming to New York City. My sister works in Hollywood. A lot of my friends work in Hollywood. I remember the last shift that I had in the Kings County ED, working in the critical care space or pod, before kind of the fire hose got turned off. I just remember we had multiple intubated patients in every pod, like every slot. People were getting sick on the main side that were needing intubation. We were receiving transfers in from Elmhurst Hospital. You know, I just thought to myself, right, even my Hollywood friends couldn't over dramatize this situation any further, right? It was end the world kind of stuff. And, you know, at that point, we had tripled, quadrupled census in our ICUs. 961 was the peak ventilated patients. We had to run sprinklers with warm water over oxygen pipes so they wouldn't freeze up. We were talking about alternate care sites. The staff, right, they were bending and almost breaking, you know, a lot of people compare this to battle, and right at some point you have to rotate the soldiers on the front line out. And so when the Department of Defense changed their mission from Javits and the Comfort to move into our four walls and take over units, we had people who just got on a plane and showed up at the front of Elmhurst Hospital and said, "I'm a doctor and I'm here to help." Just amazing stories. And then also similar to other counties and states, utilize vendors to get critical staff in. Morale was an issue. I think one of the big things that we were able to do is celebrate the small wins. For weeks and weeks, it seemed like every person that we put on a ventilator either stayed on the ventilator. Only reason they came off the ventilator was when they passed away. And so being able to celebrate across the system every extubation, every discharge, and similarly to, when a newborn is born, some hospitals will play a nursery tune. We encouraged each of our hospitals to pick a song to play every time a COVID patient got extubated. And I told my 3 and 5-year-old daughters that every time somebody got better from the virus, some of our hospitals, Jacobi and NCB, would play the Rachel Platten fight song. And so they went to Alexa and they had Alexa played fight song over and over and over again, because they were convinced that every time they played one, somebody was getting better from the virus. The moral injury, I think, right, everybody knew that this was going to be an unprecedented event. I think as an American trained, US trained doctor, you don't think about ever having to ration services to anyone, and just the threat of that. What happens if we run out? I think also something that really weighed heavily on our providers was we're used to being able to fix problems. That's why we went into healthcare. You're trained to diagnose, to give the appropriate treatment, and watch people get better. But it seemed for a small percentage of patients with COVID, no matter what you did, they were on this trajectory to need more and more oxygen, respiratory failure, renal failure, and death. So those became kind of huge things about supporting staff through that peak. PPE, airway supplies, and just things you didn't want to think about, right? Everybody pays so much attention to ventilators, but there's tubing that goes with ventilators. There's valves that go with the ventilators and filters. All of those things were getting harder and harder to find. And it's something that we were lucky and fortunate, similar to Northwell, to have a large system of 11 hospitals and 5 nursing homes. We were able to level load. We were able to move patients out of our hospitals to our skilled nursing facilities. We were able to offload Elmhurst and Queens hospitals, Woodhall, Coney Island, and move them more towards Manhattan hospitals, where those boroughs were not quite as hard hit. So we moved 850 patients across our system by using a level loading process that we stood up. We were flying this plane as we were building it. And communication, I think, at every level, communication was an opportunity for improvement here. Next slide. And like I mentioned, it felt a lot like somebody turned off the fire hose. That shift that I told you about, where I didn't think we were going to make it. 1 week later, I showed up to the Kings County ED. There were more doctors than patients in the ED. It was just remarkable how the public health kind of stay at home, social distancing, really just turned it all off in terms of the input. But there were some patients who, even though they were recovering from the virus, their lungs were still too weak. They weren't going to come off ventilator and needing chronic vents. LTAC became a big need. Our surge spaces, right? How do we get ICU surge spaces offline so that we get back to surgery and get back to other things that were holding up necessary care? Those, and dialysis, I think, was another thing that was a big challenge in this phase. And what we actually found, all the things that we did, behavioral health hotline, the wellness respite rooms, the wellness rounds, the H3 debriefs, making it easy for staff to receive support. It was really this phase after the surge where the adrenaline was wearing off, that our staff were like, oh my God, what just happened to me over the past 2 months? That's when the greatest need And I think with the social isolation, being home alone in your apartment, for many of our residents, for many of our staff, they're isolating with family, made it even harder to process. And so people like being at work because at least there's that shared experience and peer support. And we made it a goal for every internal goal for every staff member to be part of a group debrief, helping healers heal debrief. So they might maybe identify within themselves or realize within themselves that they need more help, or at least give their colleagues an opportunity to say, I'm worried about Eric, I'm going to check on him. In this phase also, so not only the Department of Defense kind of write in like a cavalry to help in our facilities and treat the medical aspects of COVID, their providers told their 4-star general, this is the closest to combat that we've ever seen in a civilian setting. And so he reached out to us through Commissioner Criswell over emergency management. Hey, unfortunately, this country has been at war for 18 straight years. We've learned some hard lessons about what combat does to a soldier's mind. Do you want us to share what we do in DoD for combat stress management and resilience? And we said, absolutely. And this quickly turned into an 8-agency collaboration. That was Hero New York, Greater New York Hospitalizations, hosted a 5-part webinar series for a train-the-trainer. 350 H&H staff have been through that training and are now training their peers within our facilities. And it's to incorporate that combat stress management and resilience into the support that we provide. Something else that we've been doing is trying to regain the trust of the patients and the communities. There was so much fear about coming in and seeking care, getting your kids vaccinated. A lot of work on how are we protecting you when you come back. Somebody mentioned plexiglass, leveraging telemedicine, even video visits when they're physically in our facilities. And then we've been doing a lot of paying it forward. We learned a lot of hard lessons. We got a lot right. We got some things wrong. And sharing that with Texas, with Florida, with Arizona, and California as they're going through. Next slide, please. And so what are we doing now? Everything is about envisioning the post-COVID pre-vaccine hospital and clinic and preparing for future waves, continue to support our staff. One of the lessons I think we learned the hard way is the alternative care sites were a little bit too late in terms of trying to get the moderately ill patients out of our hospitals. At that point, we just really had critically ill patients. And so trying to surge internally within our 4 walls is a lesson learned. There are a lot of redundancies and a lot of safety features about being in a hospital, protecting staff, education and training. I think in a future wave, we won't be so fortunate about outside help. Everyone else is going to be busy with their own states and their own counties and their own cities. So redeploying staff across our system from ambulatory care or perioperative services into our ICUs, into our EDs, we're gonna have to get better at that. And we never stop chasing critical supplies. High flow nasal cannula being one of those lessons learned, that once you put a patient on a ventilator, they don't have a good chance of coming off. So instead of the quick intubation for infection prevention reasons, let's move to high flow nasal cannula and try and keep people from getting put on the ventilator. Refining level loading, we're hoping to do this across the city, across the state, and then refining our fatality management processes. And I just think I'll end one last kind of anecdote. A lot of cheering, every evening, 7 p.m. But people were thinking about the doctors and the nurses, and we certainly appreciated that. But there was so much heroism behind the scenes. Our EBS workers, our dietitians, the facilities folks who were changing airflow on the fly and installing HEPA filters. And one anecdote I'll end with is remember getting a call at midnight from another one of our senior vice presidents saying, hey, 7 a.m. tomorrow, can you meet me at Elmhurst, meet me at the morgue? And usually when somebody asks you to meet them at the morgue, it can't be a good thing. When I got over the initial shock of, why would I meet at the morgue? Is, a lot of people had hurt their backs. A lot of people, because of the neighborhoods that they were in, had contracted COVID. They needed help loading decedents, body bags onto the refrigerated trailers. And so when I got after that initial shock of, I might be on a trailer lifting bodies, remembered, right, as a leader, you should never ask your staff to do something that you're not willing to do yourself. So absolutely, was there at 7 a.m. And I'm getting oriented to the morgue, and I realized shortly thereafter that the morgue director, because he needed help, was bringing his own son to work, and the young man was helping him, lift and load these decedents onto the refrigerated trailers and his own flesh and blood. And it was just like, just really something that I will never forget, right? That he felt so strongly about playing his part, that he brought his own flesh and blood in to help him when the staff had to go out sick with hurt backs or COVID. And so we're hoping to never have to go through this again, hoping for the best with contact tracing, with T2, but we're certainly preparing for the worst going into flu season, and what the fall and winter might bring us. So I'll stop there and turn it over to Peter to take us home.
Thanks, Eric. Good afternoon, everyone. Thanks to our hosts and my co-panelists, who are very tough acts to follow. So I'll start from the safety of an obvious statement. Next slide, please. The U.S. did not have a well-coordinated federal response. No multilateral supply chains or data share, no national production of PPE, no national testing or tracing strategy. So the states were largely left on their own, and New York City got support from New York State. But as Dana mentioned at the beginning, that had to understandably be rationed across our very big state. So New York decided to leverage its size and scale and try to act like a state on its own, or even like a nation. Like a state, we put in direct requests to the feds for support. We didn't wait for the federal response to come to us. We used our individual relationships with FEMA for morgue trucks and PPE and staff, and with key military leaders to get the healthcare workers that Dr. Wei mentioned, and the hospital ship. We acted like a state and requested mutual aid from other states and other cities. And like a nation, we did our own global procurement and our own production. Joan mentioned that all agencies were necessary for this response. And in New York City, while Health and Hospitals and NYCEM were our leads, we pulled in literally every single agency across the government. One example is we had all of our construction and permitting agencies involved in helping H&H open additional healthcare facilities. But as good as that full government approach was, we quickly recognized that that wasn't going to be enough, that we would need public-private partnerships in addition to fuel our response with fast and flexible resources. And we got them from unlikely private sector partners. Ira said at the beginning that you have to have the right team, and we recognized we also needed the right outside partners. Next slide, please. So in my new role, we created an ad hoc new office with a team detailed from across the administration. And first, we were going to ensure that we could successfully accept the outpouring of private assistance that was coming our way when New York was the global epicenter. Key elements of that, we stood up big COVID relief funds, primarily at a C3, a nonprofit associated with the mayor's office, but also at Health and Hospitals, at our Department of Education. And we built structures around them, for example, a web portal for PPE donations. And we were very clear to have narrow specs about what we would accept, so they weren't getting donations of things that were going to be harder to use or to share with healthcare workers or other New Yorkers than was worth it. So we had narrow specs. We added staff on the back end to manage a process. We created a warehouse operation. We had a Q&A operation. We eventually had an operation where we could distribute PPE donations beyond our healthcare workers. But of course, that took several months. We also wanted to make sure that we could solicit types of support that we seldom ever asked for as a city. We built another portal to ask private owners if they would share space with us so we could find sites for beds. We created one to encourage people to sell PPE to us to try to sort of rationalize that process in the early chaotic days as we were learning how to deal with broken supply chains, how to buy directly from China. We put together a portal to solicit partners to help the city manufacture PPE right here at home, and one to recruit and credential healthcare workers from around the country. Happily, we paused many of those operations, but they're ready to be turned back on as necessary, and we think they're also replicable by other jurisdictions. These collective efforts helped us raise tremendous additional resources that we could use faster than sometimes government procurement or government budgeting allowed, and supported our healthcare response. In 4 key areas, and our broader response to the pandemic, healthcare, emergency food, remote education, and emergency financial assistance. But we're just going to talk about healthcare today. Next slide, please. Dr. Wei pointed out that we had to expand how we deliver care and do it on a sort of unprecedented scale here in the city. And we relied on lots of creative partnerships to make that happen. We added something in New York City, more than 26,000 additional beds, stood up 7 surge sites. The top photo here is the Billie Jean King National Tennis Center, because the U.S. Tennis Association gave us that space to set up a field hospital. We rented 11,000 hotel rooms so we could create more patient beds, space for New Yorkers or healthcare workers who needed to isolate away from home, could sleep. We were also housing out-of-town healthcare workers, and we were doing it with small local hotels and big national chains like Marriott. We recruited healthcare workers from all over. Something in the order of 14,000 volunteered to come help us fight the virus. We hired them through temp agencies. We brought in the military. We had volunteers from all over, and one of the inducements was partnerships with multiple airlines to provide free flights to lower the barrier to entry so people could come here and help. As Eric mentioned, we had to support those healthcare workers who were on the front lines and other essential workers. We raised funds and put together a partnership to deliver 400,000 grocery bags to workers in 100 hospitals, delivered by Aramark and Red Cross. We raised funds to deliver 100,000 meals to hospital workers, morgue workers, staff at nursing homes, and our sanitation garages. We did projects to provide Uber rides when public transit wasn't available for folks working late shifts. We got them personal care items when so many businesses were shut down and our healthcare workers couldn't shop for themselves, because when they weren't working, they just couldn't access open stores, restaurants, etc. And in our closed public schools, we opened emergency child care centers for essential workers. We worked to get critical PPE, one of the hardest things I know everyone faced. We built on the skills that our public hospital system already had, but that we knew wouldn't be enough. So we took all of the city's procurement and contracting resources and built a new sort of citywide team to take this on, to buy from all over the globe. We brought in supply chain consultants. We created a committee that could approve partial prepayment, anything to help us move quickly in that space and try to do procurement in a way the city never had before. we built, as the mayor referred to it, as almost a wartime manufacturing effort, partnering with unlikely players like fashion companies that ordinarily make dresses for Saks, connecting them with military body armor manufacturers to churn out hundreds of desperately needed surgical gowns in the Brooklyn Navy Yard. We were also producing our own face shields here in New York, and with partners 3D printing nasal swabs for test kits. We got very creative, and we solicited massive amounts of donations, primarily of PPE, in significant batches, 10,000 units, 100,000 units from big companies headquartered here and around the world, Goldman Sachs, Apple, Louis Vuitton, sometimes unusual partners. The Metropolitan Museum of Art, we learned, uses certain key PPE in their conservation efforts. We talked to Anheuser-Busch about repurposing beer production to make hand sanitizer for New York. We talked to all of our building trades partners here during the pause in construction to share PPE they weren't using. We talked to closed veterinary and doctors' offices. And we learned to make asks of partners that weren't their core businesses or how we traditionally think of them. We asked for plastic from soda bottling companies. We got logistics and warehousing support from department stores like Century 21. We got refrigerator trucks, as Eric mentioned, from Starbucks. And happily, we were eventually able to focus on testing and tracing and not just delivering care in hospital settings. And there, of course, private partners, academia, were critical. We partnered with a global disaster relief organization to stand up one of the first mobile testing units that we had in the city. And as some of you may have read, the mayor in the city just announced our own pandemic response lab here in New York City, where we can do our own testing and be kind of responsible here in New York for being able to turn around tests in like 24 hours. And that grew out of a group that we convened, a testing innovation council, to bring together some of the best minds in the city to think about, what could we do locally? And we wound up putting together academic resources, a private partner, and the city to kind of open this resource. I want to stop there so we have some time for Q&A. I appreciate everyone's time.
Great. Thank you, Peter, Ira, and Dr. Way. And I also want to thank Ariana Kaplan, the mayor's senior advisor for intergovernmental partnerships. She's been a terrific ally and partner of mine and NYSEC, and we're lucky to have her on our team working with us as well. So at this time, Dana, I have a few questions here in the queue that I want to get to, and then maybe we can open it up for a brief roundtable discussion. But the first question, which I believe will be for Dutchess, New York, and Westchester, is comes from the Southern Tier, and the question is, how is everyone handling the September 15th cutoff for FEMA claims? What if you have a spike or a cluster that creates an uptick in cases and PPE use and expenditure? How are you going to handle that?
Joan, you can answer or I can, but my understanding currently, and anyone's free to question me on this or disagree, because I looked at this yesterday in reference to an action we had to take yesterday. The event has been extended to quote unquote ongoing. And as long as it's related to minimizing or stopping the spread of COVID in the community, with the caveat it's eligible, not guaranteed you're going to get reimbursed, that the end period is extended past September 15th. It's now ongoing.
Yes, that's our understanding as well.
Agreed.
Great, thank you both. This next question is in response to something that Peter just mentioned, using the manufacturing facility to help do the 3D printing for test kits. how do we address the challenges with New York State supply test kits? I understand New York City had a manufacturer that helped them out. Do we have access to that same kind of manufacturer in other parts of the state? Peter, is that something that maybe if a county is looking to get some supply test kits, are they able to work with you and the New York City team to explore purchasing those?
So first, just picking up from something Eric said, I think we're all who've been through this want to sort of pay it forward and help colleagues around the state and around the country in any way we can, lessons learned, resources, et cetera. Through Ari or through our organizers, if they reach out, we'd absolutely have a conversation. You know, our first priority, of course, is ensuring the testing capacity that we need here in New York City. But we're all in this together as a region and as a country. And so we look forward to helping any way we can.
Great, thank you very much. Okay, and then our last question on the queue, Dana, before I turn it over to you is, how will we address the flex and surge plan to ensure resources aren't unnecessarily reassigned to other locations across the country? How do we work together to ensure there's checks and balances to meet New York's needs? I guess from my perspective at NYCEM, you know, we've worked together with all the counties on this issue, and you know, should a county have an emerging need with their PPE or other medical equipment, we've certainly worked with many counties to get those requests to the governor's office to try and triage that response. But if anyone has anything else to add, please feel free.
I would add just that it comes down to communication and conversations with colleagues at the federal level, right? Peter mentioned we've had direct conversations with FEMA Region 2 here in the city, and I know our colleagues at the state have had it, and making sure that you're constantly letting them know what your challenges are, what you're looking at, what you're planning for, so that they aren't surprised if you are in need of something, and that they can advocate for you when they hear about movement of resources at the federal level, that they know that they've heard that there are concerns or challenges locally in the New York region. That would be my recommendation.
Thank you very much, Ira. Dana, that's all the questions I have in the queue right now. If others come in, I'll chime in. But did you have anything that you wanted to discuss with our panelists this afternoon?
Yeah, and for the entire group, I think this presentation has led up to the billing, the expertise and the experiences of everyone. Although it's relative, I have to admit I was a little jealous when Peter talked about how they established a special procurement group with all the resources in New York City, and here in Dutchess County we had me. You know, and I was Skyping with China at 1 o'clock as well. I think that was one of the biggest challenges, is that all of us were kind of on our own, and here in Dutchess County with 300,000 people, we were operating as a nation as well, which created significant challenges. And I hope as we go forward, we continue to communicate and work as partners from that perspective. Although, you know, everything's relative based on your size and the impact. And you know, when the doctor was talking about 11 hospitals across one system, we have counties that are probably on the line that don't have a hospital in their county. So we all address the same things, maybe in different ways, and I think those are good lessons to take away from this event and this presentation today. It has to be scalable back to, you know, your home, but I think we're all trying to continue to address the same thing. I don't know if Ira or Joan or anyone else wants to add to that, but.
No, I think that you've said it pretty well, Dana, and I think as we all experienced that you rely on the team, you rely on the experience and the expertise of the people that work for you, and when even when we are, whatever the situation, a group of one, if the need arises, but I think the professionalism and the creativity that every government across the state has demonstrated is a true example of how we will get through this.
I would agree. Thank you. Anything else that, Ryan, I don't know if you have any more questions that have come up, or is there any points that weren't covered in the last few minutes here that the panelists would like to add?
This is one thing I would say, and is that, you know, there's the resources and production and relationships that vary from municipality or county to county. But I think one of the things that I'm excited about this opportunity is really the ability to just talk through scenarios and have conversations and brainstorm with colleagues at every level, because I think at the end of the day, we have different resources supporting us, but the approach is going to be similar, need to be similar at every level. So I think you know, that to me is really the key takeaway, is making sure that the lines of dialogue are open, so that if someone has a question, they can just pick up the phone and chat with someone, talk through the scenario. That's just my looking forward idea.
I would agree with that. And one of the things that I found beneficial early on was participating in the state association calls as well, because it was, you know, I wasn't on every single one of them, but those that I were beneficial, and good solutions came out of those calls. I know it made for a very long day for all of us who participated in those, but that networking, as you say, and those relationship building is going to be key going forward. And I think that was the most consistent and probably the best thing that came out of this event.
And I would just say, I think one thing that I've learned from all of you and also from all the counties across the state is how the people have really adapted to, and Joan, you talked about this with having to prepare a mortality plan in Westchester, a mass casualty plan, but I think everyone has really adapted to gearing up and managing a large scale, long duration public health crisis, and something that we haven't really been faced with this kind of magnitude in a very long time. And, you know, certainly, Dana, to the point that you just made, the association will be here working with everyone going forward, and hopefully we don't have a spike in the fall. But I think one thing we've all been able to take away, and one lesson that we've learned, is, you know, we have each other to learn from, to work on and troubleshoot issues with, and that's pretty powerful. So with that comment, I just want to thank everyone for attending this fall seminar workshop. And I want to thank all of our speakers from Westchester County, Dutchess County, and New York City for joining us and presenting. And of course, our workshop sponsor, NYCEM, for sponsoring this afternoon session. And before I conclude, does anyone have any last remarks that they would like to say? Okay, it's silence. So everyone, again, thank you for joining us, and a recording of this webinar and a copy of the slideshow will be on our website, nysac.org/fall seminar, and we hope to see you at our next virtual fall seminar workshop. Take care, everyone.
Thank you,
Thanks,
everyone.
Ryan.
Thank you. Good afternoon.
Thank you very much.